Digoxin, cardiac glycoside, antiarrhythmic agent. Toxicity may occur even at therapeutic concentrations in some settings, such as hypokalemia, and we should periodically monitor digoxin concentrations as appropriate for the condition being treated, especially if the kidney impairment occurs. Used for the control of ventricular response rate in adults with chronic atrial fibrillation, and for the treatment of stage C as recommended by the American College of Cardiac Foundation and the American Heart Association. Mild to moderate heart failure in adults to increase myocardial contractility in pediatric patients with heart failure. Or off-label use, sustained fetal supraventricular tachycardia by maternal administration for the transplacental transfer to the fetus, and for the treatment of and for supraventricular tachycardia, such as atrioventricular nodal reentrant tachycardia. Mechanism of action in the heart failure, inhibition of sodium-potassium ATPase pump in myocardial cells results in transient increase of intracellular sodium, which in turn promotes calcium influx via the sodium-calcium exchange pump, leading to increased contractility. In supraventricular arrhythmias, direct suppression of the AV node conduction to increase effective refractory period and decrease conduction velocity. Positive inotropic effect, enhanced vagal tone, and decreased ventricular rate to fast atrial arrhythmias. Atrial fibrillation may decrease sensitivity and increase tolerance to higher serum digoxin concentrations. Onset of action, heart rate control, oral 1 to 2 hours, IV 5 to 60 minutes. Peak effect for heart rate control, oral 2 to 8 hours, intravenous 1 to 6 hours. Duration 3 to 4 days. Protein binding approximately 25%. We should also notice that in uremic patients, digoxin is displaced from plasma protein binding sites. Oral bioavailability 70% to 85% for the elixir, and when it comes to tablet, 60 to 80%. Half-life elimination, it depends on the age, renal, and the cardiac function. For the neonates, premature 61 to 170 hours, and for the full-term neonates, 35 to 45 hours. Infants, 18 to 25 hours. Children, 18 to 36 hours. Adults, 36 to 48 hours. For anaphoric adults, 3.5 to 5 days. Time to peak, oral 1 to 3 hours. FDA approval date is October 24, 1975.